And here we go. Welcome everybody to The Big Idea. This is Dr. Jeffrey Hanna here at Clear Chiropractic. And I've got a really interesting one here today. This one is emphasizing the importance of neck movement and how it relates to circulation about the brain. And this is super important for people if they experience pressure, dizziness, vertigo, headache, migraine, but also various kinds of neurodegenerative kind of diseases. This can include Alzheimer's, this can include MS, this can include Parkinson's dementia, this includes people with fibromyalgia, this includes people with anxiety, depression, brain fog, post-concussion syndrome, the list goes on and on and on. And even in this particular little research, they're not talking about these conditions, but I'm going to make a little bit of a link here in a very, very interesting kind of way. So if this topic sounds like it's going to be interesting, please right off the bat, make sure that you click that like and subscribe button so that you can find out more information about all this sort of stuff. Anyway, let's get right to it. All right, what do we got for you? The effect of a cervical collar on optic nerve sheath diameter in trauma patients. What in the world are we talking about here? So we'll rewind a little bit first before I get into this. Cervical collar. This is the idea that a person is deliberately immobilizing their neck like this. Now, if a person has just experienced a fracture or something like that, yes, please, you're going to want a cervical collar to support that. But we know from the research that's been done on cervical collars that they oftentimes are not actually going to be supporting a person that well. You're probably familiar with that expression from going to the gym. If you don't use it, you lose it. And what we know is that when a person wears a cervical collar, you have a tendency to actually get weakness of the various muscles that are designed to support the weight of your head. If that happens, you're more likely to experience future neck injury. In other words, the very device that's designed to prevent injury contributes towards injury. Now, what these particular researchers were doing, they weren't looking at that at all. They wanted to look if wearing a cervical collar made any change to the optic nerve sheath diameter in trauma patients. What we're talking about is we're looking at the fluid around the eye, specifically the optic nerve, because your eye, window to the soul, it's actually a direct extension of your brain that you can physically see and physically see out of. And you can measure the diameter of the optic nerve using a conventional CT scan. And what we know is that if you ever see swelling or an increased optic nerve diameter, it means that there is swelling around the brain, that the cerebral spinal fluid is not circulating the right way. So what the researchers did, they wanted to see if by wearing a cervical collar there was any change to the apparent optic nerve diameter, which would indicate that there's swelling in and around the brain. So now I'm going to summarize what the researchers found because otherwise it's a little bit complicated in terms of how it's written down here. This was done in an advanced trauma life support hospital setting, and they are measuring optic nerve diameter using a conventional CT scan in people who either did or did not wear a cervical collar. The study was of 169 patients total. 66 of those people were having a collar on their neck, and then the other 103 were not. What they found in the normal individuals, that was people who were not wearing a cervical collar, that the average nerve diameter was measured as 5.04 and 5.11 millimeters total. However, the people who were wearing cervical collars, their optic nerve diameter was 5.43 and 5.50 millimeters. In other words, a 7 to 8% increase in the total diameter, which I know that seems relatively small, but when we're dealing with something very, very sensitive like the brain, a 7 to an 8% increase of diameter, of swelling, of abnormal fluid flow can make a very profound impact. In fact, we know from other research that the brain pressure itself is usually only going to be about 15 millimeters worth of mercury pressure. That's going to be about the weight of a single penny that's going to be present in and around the brain at any period of time. And that's what CSF is designed to do. It's designed to keep the brain buoyant, floating inside of the skull like this. However, if we ever have an increase of pressure, that's going to, number one, on a microscopic level, start to affect pulsatility, which means that you're not going to have normal circulation, normal flow of the tissues inside of your skull. What it can also do on a macroscopic scale is it can start to disrupt the normal dynamics of CSF flow. And if that's not able to continuously flush itself out, if the plumbing of your brain itself is not flowing the way that it's supposed to, you can start to have abnormal congestion of things. Imagine, if you would, water in a dirty sink. It's not clearing out properly. Well, if that's going on inside of the head, that can start to accumulate and start to lead to a number of neurodegenerative conditions. Alzheimer's, Parkinson's, MS, they all have links. And this also seems to be one of the issues when people experience whiplash, post-concussion syndrome. Any number of issues here is that the fluid in the brain is not circulating the way that it should. And if that happens, that shifts the brain into a pro-inflammatory state, meaning that it doesn't take near as much stress, whether mental stress, physical stress, or chemical stress, to aggravate things, which is only going to exacerbate those particular kind of symptoms. Now, let me showcase a little video here, and I show this one oftentimes on a number of my videos because it illustrates things very, very well. And I want you to pay attention to this image that you see on the right side. But let's first give you a bit of orientation. That CSF, that fluid that's around your brain, is all of this white stuff right here. This is the way that it would be circulating on a normal MRI, but on the right, this is what's known as a phase contrast MRI, where in brief, you can see that pump mechanism working better. But as we just talked about, if you have excess amounts of fluid, then that's going to start creating pressure. Again, the researchers were having a look at it in terms of was there additional swelling around the optic sheath. But we know that if you've got a problem wrong with the eye, that is actually a measurement where there can be a problem with your brain itself. Now, to bring that back round to what the researchers were talking about here, the only difference between the two groups of people was immobilization of the neck. Some people were allowed to move their neck, and other people had a device that prohibited the movement. We believe, and as we've been seeing in a large amount of research, that the health of the neck, its ability to move, its ability to function properly, has a profound impact in terms of maintaining that normal CSF flow. But if we are immobilizing the neck, either A, because we're doing it on purpose with the hard device, or if things are locked perhaps in an abnormal position, that can prohibit the normal circulation. You can start to have the buildup of fluid, and as a consequence of that, that can go on to affect your brain function. And this can be very frustrating for a lot of people where they would have the conventional MRI or the conventional X-ray scan, just as we showed you there, and they're told there's no sign of pathology. Most pathology is not diagnosed until you can measure it in large millimeters. They're not looking at micromillimeters. They're also not looking at functional disturbances such as you could measure with an optic nerve change. Again, even a change of a 7 to 8% increase of fluid is actually very substantial in terms of how the brain is going to work. And as a consequence, people can go from doctor to specialist looking for all kinds of different things, but they're not finding pathology. Why? Because they're not considering the functional relationships, and oftentimes not considering how the health and the normal mobility of the neck can impact the brain function. We know from other research that it is indistinguishable based on symptoms alone to tell the difference between concussion and whiplash, because it is impossible to have a head injury without also affecting the neck. And so much attention is applied to the brain, which is good and wonderful, but unfortunately that neck is oftentimes forgotten. This is a super important message for any person who is experiencing what they can only describe as fogginess in the head, body pain, pressure, or just something is not right on the inside, that intuitive sense. Trust it. You have that for a reason. But one of the other things very important is recognizing that your neck very well could be one of the contributing factors in terms of what's going on here. So maybe this is me just geeking out a little bit over the importance of this, but emphasizing the importance of neck mobility so that your brain can work the way that it's supposed to. I hope you enjoyed this particular video here. If you did, please do click again that like and subscribe button and share this video with friends, family members, clients, colleagues, anybody you believe would benefit from checking this out. And if you want some more information, you can go to Chiropractor Spokane. That's our company website where you can find all kinds of other videos, blogs on the different kinds of people that we're able to help. And if you're looking then for an upper cervical chiropractor near you who would be able to help you out, you can visit uccnearme.com. Thanks again for watching this. This is Dr. Jeffrey Hanna here at Clear Chiropractic. Get well, live well, stay well. Till next time, take care. Bye-bye.